Hey you guys, Dr. Stirrett here. Today I'm going to be talking about how to lose weight on a GLP-1 so fast it'll feel illegal. Just kidding. It's not going to feel illegal, but it's going to be really fast and it's going to be more sustainable. So I want to share 5 things that I have my patients do that we double down on to ensure that not only are you losing weight on a GLP-1, you don't get stuck in a plateau, or you're able to work through a plateau, but you make this a more sustainable deal so you're able to titrate off the medication or come off the medication at some point, making sure that you're not dependent on the medication for the rest of your life in order just to lose 20, 30, 40 pounds. This should be doable with the medication, but you should be able to come off of this ultimately and repair your metabolism, repair your insulin resistance. And I'm going to share these 5 ways that my patients are doing this right now that I think will be of vast benefit to you. Now, towards the end of this, I'm going to actually do a sample lab report and show you how, from a functional medicine perspective, where a patient was actually getting held back and how these 5 things apply to this blood work and what were these roadblocks were in her blood that were actually preventing her from losing weight and blocking Wegovy or semaglutide, a GLP-1 medication, from doing its job. Let's dive into it today. Tip number 1 is this concept of microdosing. It's really just anything below what that standard dosage of semaglutide is or tirzepatide is when we're talking about GLP-1. So for semaglutide, that would be anything under 0.25 milligrams, tirzepatide 2.5 milligrams. Anything under that, dosed maybe once to 2 times a week, depending on the person, this may have a huge impact on you, and you may not need to jump all the way up to these massive dosages that doctors are prescribing these days. Now, what happens when you get a massive dose of semaglutide or you keep increasing your dosage? Let's say we do a starting dosage of 0.25 milligrams with semaglutide. Within a week or 2, we increase it to 0.5 milligrams. Then a month later, 1 milligram, 2 milligrams, and then I think the research for Wegovy goes up to 2.4 milligrams. This is way more stimulation of that GLP-1 receptor as an agonist than you likely would have ever received at any point in your life. And of course, you're going to shut off hunger because you're overstimulating the receptor, both in the gut and in the brain. So you're going to shut down digestion, you're going to shut down hunger, and you're really going to make your body dependent on this medication for the rest of your life. Now, you may be okay with this, but I really don't want this for my patients. And so microdosing is where we find the lowest effective dosage for you and your body, usually injecting 1 to 2 times a week, maybe more. So microdosing can be extremely beneficial, but what will happen most people, even with microdosing, is a lot of times you'll hit a plateau. Unless you consider these next 4 things, you will likely hit a plateau, and it can lead to a lot of frustration. It can lead to people just quitting the medication, saying, hey, this wasn't for me, it didn't work, I lost 10 pounds, and then it just stopped working. I increased dosage, and then I started getting side effects. Like, this is the typical thing that I see when patients come to see me. And so I really want to share with you how my patients are overcoming this right now. Tip number 2 is going to be diet really matters. Now, if you've watched anything on my channel, you know that I've talked about how dairy, nightshades, and legumes can really limit somebody's weight loss and don't really pair with semaglutide all the time. That's not an absolute. This is just a rule of thumb that I stick by. And if somebody hits a plateau, then that tells me something. It tells me it's time to double down on diet. When you're clicking along and you're losing weight and it stops, it means that the level of inflammation and that level of insulin stimulation, it's hit a moot point. And what we want to do is say, hey, before we increase dosage or change things up, let's go ahead and really shake things up in terms of diet. Now, maybe you're just trying to eat as clean as you can, but this is a time for you to double down and say, look, breakfast, lunch, and dinner, are you eating out? How much processed food are you eating? What are you allowing? How are you eating too many carbs? Are you getting enough protein in your diet? If you're a woman and you're getting less than 80 grams of protein in a day, this is a massive red flag, and your macros likely need to be adjusted at this point. You need to be getting more protein. You need to make sure that you're not eating too many carbs, too many processed foods. And a lot of times people will say, no, Dr. Stirrett, I'm doing all those things. And then we dive into their diet and we find the nuances. So what you want to do is you want to do a diet diary for a couple days and look through it and ask yourself, honestly, is there anything here that could be causing inflammation? Don't be the person that says, no, that's fine. My body, it was just this one time, or it was just this one time. Don't nickel and dime yourself, because what you'll want to do in this state is say, hey, for the next 5 days, I'm doubling down. I'm going to be eating lean proteins, vegetables, low carb, and no processed food, no eating out. I'm going to meal prep, maybe do some smoothies, take the guesswork out of it, and really just make sure that diet doesn't have something to do with this. Now remember, dairy, nightshades, legumes are the common areas where I see people fail. A lot of people will be like, I don't eat dairy. I don't eat much dairy, but yet they're having cottage cheese, or they're having yogurt every morning for breakfast, or they're eating like a cheese as a snack like 3 or 4 times a week. This is enough, or creamer in the coffee. This is enough to stop weight loss if your body is sensitive to it. And it's all about you. It's all about your personal experience with food, how your body's breaking these things down. It's not dogmatic. Like, those aren't the 3 things that you must avoid to lose weight. Those are the 3 things that I see be the roadblock most of the time. So it could be gluten, it could be soy, it could be eggs for all that matter. Those are all top allergens, but I always start with those 3. Tip number 3 is going to be, please get your blood work checked. I don't know why doctors don't check anybody's labs before starting semaglutide, probably because it's just a cash cow money grab for our medical system, which is sad. But the point of this is, if we know where your markers are for a lot of different functional tests, hormones, inflammatory markers, if you have autoimmune disease, we can check your blind spots. Like, we can literally identify the areas that are likely leading to the root cause of your weight gain to begin with, and we can make sure that we're adjusting those. So tip number 4 is going to be, for the love of God, please check your hormones. Now, checking your hormones: estrogen, progesterone, testosterone, and thyroid hormone. Now, with this stack, I've come to understand a few things, particularly with women's hormones. With women not sleeping at night with low progesterone, it's probably because you have low progesterone or estrogen progesterone imbalance. And unless that gets settled and your sleep gets taken care of, it can be very difficult to fall asleep. That's the root cause. Likely it's throwing off cortisol balance. It's bumping up cortisol at inappropriate times. It's leading to increased blood sugar and insulin resistance, and leading to your weight gain. So I always tell people, like, if you're not sleeping, this is probably a root cause of why you're insulin resistant. It's leading to excess stress in the body, and that excess stress will lead to blood sugar and weight gain and cortisol imbalance. So we have to get people sleeping, and a lot of times progesterone is a key piece to this. We're going to look at this lab review here in a minute, and I'm going to show you how this plays out in real time and some adjustments that we would make for a patient. The other hormone that I want to hone in on here is actually the thyroid hormone. So now, not just thyroid, TSH, that your doctor checks once a year and says your thyroid's fine and you don't need to worry about it. I'm talking about free T4, free T3, and your thyroid globulin and TPO antibodies. This way we know, do you have autoimmune disease? Do you have inactive hormone? Do you have active thyroid hormone? And what's your TSH doing? You start to get the full picture. Now, in the patient that I'm going to show you, everyone's told her she's good, but guess what we're about to see? We're about to see a low T3, which means a low metabolic rate. If you have a low metabolic rate, you're not going to be as heat efficient. You're not going to be burning calories as efficiently, and you are going to have hypothyroid symptoms: weight gain, constipation, dry skin, hair breaking, all the things. So we'll take a look at that in just a moment. Number 5, how inflamed are you? Do you have inflammation in your body? We need to check this in the blood work. Why? Because we want to put a number on paper saying, how inflamed are you? Where are you inflamed? What markers are showing this? Do you have autoimmune inflammation? Is it from something else? Is it cardiovascular in nature? These are things that we have to check, because not only is this going to impact your weight gain, but this could be contributing to an autoimmune disease that's underlying for you. This could be contributing to some more serious health problems like cardiovascular disease and Hashimoto's and worsening conditions. You want to handle this. What it all comes back down to a lot of times with inflammation is leaky gut, inflammation in the digestive system. And why does that happen? It's digestive damage over time due to food sensitivities. It's not like everybody just eats at Taco Bell and McDonald's every day. And some of us do. And that's going to lead to gut damage, but it's where we nickel and dime ourselves. It's pizza night on Friday, and then the next day it's the taco bar with too much salsa. And the day after that, it's a grilled cheese sandwich. And then the day after that, it's tomato soup and Tabasco sauce and Thai food for dinner. Or, you know what I mean? We justify certain things, and then most people will say, I eat a really healthy diet. I don't know how this could be happening to me. And the labs really help put things in perspective. It's saying, hey, there's a problem right here. And then you could work with a doctor like myself to take a look at all these labs, extrapolate the data, put together a plan for you to completely reverse these things so you can actually get the most out of your GLP-1 medication. This is how we work with people. This is why I do what I do. to uncover your blind spots and actually get you to a place where metabolically, hormonally, from an inflammation standpoint, that your body is recovering in a way that you're not just going to lose weight, but you're going to have better longevity. Like you're going to not die from cardiovascular disease someday. Hopefully, it'll buy you a lot more time in your life, because these are the markers that literally tell you where you're at in every regard. Can you tell I'm passionate about this? Let's jump into the labs. All right, you guys, so what we have here is a full functional panel. I'm just going to do a quick review on this because I think it's super relevant to address what we just talked about. Now, what we have here is a 50-year-old female, and she is struggling with a lack of weight loss. She was on a GLP-1 medication. She did have some side effects associated with it. She had to quit because of those side effects: nausea, constipation. I believe this was because she was on too high of a dosage. She did not lose much weight, and she ended up having to quit. So now she's coming to me. She wants to continue and resume GLP-1 therapy. And I want to show you guys these labs because there's a few things that we absolutely need to tackle with this patient. And if you don't get these labs done, you have no idea what's going on in your body. So let's just take a look at this. So yes, her blood glucose is too high. Hemoglobin A1C is also too high. So she is a good candidate for GLP-1. A little bit down below, you'll see that her insulin levels are also elevated, about a 12, and 5 is what's normal on that. So it says it's normal here on this panel, but it's literally over double of what it should be. So also we check apolipoprotein B, LDLP. These are different cholesterol tests that will show you where you're at metabolically. And I believe personally that these tests are a reflection of what's happening in our digestive system and a reaction to what we're eating on a regular basis for the most part. Now, when I see levels like this, this does not scream like a genetic problem to me. This more so screams that this person is in desperate need of dietary change and dietary intervention. So that's something that I work with on each and every patient, as that is a pillar to their health. All right, so getting to the good stuff here, you guys. Let's just jump straight to the thyroid. What's happening here? We have a normal TSH, and T3 is absolutely in the gutter. I usually treat anything under a 3 with thyroid hormone. That is a 2.7. This could absolutely explain why someone would not lose weight on a GLP-1 medication. 2.7 is just too low for a metabolic rate, and it needs to be adjusted, whether that's through herb supplements, working on conversion, because she does have a nice T4 here. And there are some different herbs, some different supplements that can help. Things like guggle, things like selenium, zinc. These are all things that we know can help with that conversion from inactive T4 to active T3. So this is an area of focus. I will probably just recommend this person starts thyroid hormone. B12, functionally low. I want to push this closer to 1,000. C-reactive protein, super inflamed. This goes exactly back. This jumps right back to what I'm talking about when I talk about this LDLP and this apolipoprotein B. Very much so connected, and we need to work on diet to decrease inflammation. We need to work on leaky gut to make sure that there's nothing else happening there. FSH, 79, so this patient is definitely in menopause. And here we come down here. Estradiol is at an 18, so she is making some estrogen still, not very much, and then 0 progesterone. So I'm guessing she's not sleeping at all, and she's probably getting very little sleep, and this is contributing to cortisol imbalance, which will increase insulin and blood sugar over time. This person needs to be on some oral progesterone at night for best results here. And if she's getting hot flashes or having any other vasomotor symptoms, it would be in her best interest to increase the estrogen as well. Testosterone is not looking bad at all. That's not the problem. Homocysteine, very high. Need to get that under 9, so she needs extra B vitamins. She's inflamed, sed rate. This is usually more autoimmune-oriented inflammation, so we want to take a closer look at that. She did test negative for rheumatoid arthritis or rheumatoid factor. We did check her for thyroid antibodies. This is just looking for Hashimoto's or Graves' disease. Both of those came back negative, so this is not autoimmune disease of the thyroid, but she did have a positive ANA, which means that her body is attacking itself to some degree. This will likely calm down once we handle her gut, fix diet, improve hormones, all the things that are likely blocking her weight loss to begin with. Vitamin D looks good. And there you have it, guys. That's how it breaks down in real time. That's how I do it with patients, and build out a plan accordingly to what we're seeing in the labs. Now, if you want me to do this for you, if you want this exact panel, I will run it on you. We'll get you a naturopathic functional medicine perspective and really get you taken care of to help gear your body to lose weight on GLP-1. This is what we're doing each and every day, all day long. Go ahead and apply down in the link below. I look forward to hearing from you. If you like this video, if If you enjoy this, you want to see more of this stuff, give me the thumbs up down below, smash the like button, and go ahead and leave a comment down there for us. And until next time, I'll see you next week. Take care.